In the United States, a single mistimed blood test can reshape your entire health journey. You walk in feeling fine and walk out labeled with diabetes, high blood pressure, or even stage 2 heart failure. And once that label is written into your records, it tends to follow you for life. Take Mr. Ronald, a 64-year-old retired teacher living in Florida. A few weeks ago, he dropped by his clinic for a routine checkup. Nothing serious, just his yearly screening. That morning, he'd had a full breakfast: banana, pancakes, syrup. The nurse took his blood pressure once on his right arm. It read 148/90. Just like that, he was told, "You've got hypertension." Blood was drawn right after the meal. His glucose came back at 178. "You're likely diabetic," the doctor said. Metformin and statins were prescribed, 2 lifelong medications added to his chart in under 15 minutes. 2 days later, his daughter, a registered nurse, wasn't convinced. She tested him at home early morning, fasted. Blood pressure, 125/78. Glucose, 95. Everything was normal. What went wrong? Just 2 things: the wrong time and the wrong context. That's all it took to turn a healthy man into a chronic patient. And Ronald isn't alone. If you've ever done a blood test after a meal, in the afternoon, or when you were anxious or dehydrated, your numbers may not reflect your real condition, but they're still used to make life-changing decisions. In medicine, timing isn't just important, it's everything. Your blood is never still. It changes hour by hour, sometimes minute by minute. Yet most doctors make lifelong decisions based on a single sample, taken at one moment in time. That's not precision. That's guesswork, wearing a lab coat. Let's break it down. From the minute you wake up, your internal rhythm, your circadian clock, starts shifting everything. Cortisol, the hormone that helps you wake and stay alert, spikes around sunrise. That one hormone affects blood pressure, blood sugar, and even how your liver handles fat. So testing at 7 a.m. versus 4 p.m., entirely different landscape. Eat breakfast, of course your glucose goes up. So do your triglycerides. That's not diabetes, it's digestion. Feeling nervous or rushed, your stress response kicks in. Adrenaline, cortisol, they don't wait for logic. They push up your blood pressure and sugar, even if you haven't had a bite. And then there's water, or lack of it. If you're slightly dehydrated, your blood thickens. Lab machines don't know the difference. They just report elevated kidney numbers, liver enzymes, maybe even heart markers. But the problem wasn't your organs, it was your hydration. Now here's the kicker. Most doctors never ask. They don't ask when you tested, or what you ate, or if you slept poorly or walked in under stress. And without that context, the diagnosis becomes a trap. Your body is fluid. But the judgment? It's frozen in a single data point. So don't toss your old test results. Keep them, because patterns tell a deeper story than any one number can. And once you learn to read that story, you take your power back. Number 10, fasting for too long. Margaret, 67, from Minnesota, thought she was playing it safe. She fasted for 16 hours before her blood test, skipped dinner, skipped breakfast, even skipped water, believing that anything less might ruin the numbers. By the time she arrived at the clinic, her body was already struggling. Dizzy, lightheaded, dry-mouthed, she sat through the blood draw trying not to faint. The results? Her glucose was elevated. The doctor flagged her for prediabetes and ordered extra testing for liver function and insulin resistance. But here's the truth. Her liver had panicked. After too long without food, it dumped glucose into the blood to keep her upright. It wasn't disease. It was survival mode. 2 days later, after a normal 9-hour fast, her labs were perfectly fine. That first diagnosis? Unnecessary. But how many other older adults are quietly mislabeled every day for the same mistake? 8 to 10 hours, that's the sweet spot. Go past 12, and you're no longer helping your body. You're confusing the system. Number 9, exercising before the test. John, 60, from Arizona, wanted to wake up his system before heading to the clinic. So he took a brisk 20-minute power walk around the block. He arrived looking healthy, slightly flushed, a little sweaty, breathing steady. But the numbers told a different story. His CRP was elevated, cardiac enzymes up, glucose pushing the upper limit. The doctor raised a red flag, ordered a heart ultrasound, mentioned inflammation, but John felt fine. His heart was fine. The only thing wrong? Bad timing. Exercise, even light, can raise cortisol and adrenaline. In young bodies, those effects fade fast. In older adults, they linger, and they show up on lab reports as red alerts. That morning workout, it didn't boost his health, it blurred the truth. If you want clean labs, rest your body for 10 to 12 hours before testing. No walks, no workouts, no yard work, just stillness. Let your numbers speak without the background noise. Number 8, taking supplements or herbs before the test. To most people, supplements feel harmless, natural, safe, but the lab doesn't see it that way. One capsule of fish oil can thin your blood. A turmeric pill can activate liver enzymes. Ginseng, garlic, green tea, they all shift hormone levels, clotting, or detox pathways. On paper, it might look like liver trouble, thyroid imbalance, or abnormal cholesterol, but none of it is real. It's just residue from that healthy morning routine. Stop all supplements and herbs at least 24 hours before your test, unless your doctor specifically tells you otherwise, because even the cleanest pills can muddy your numbers. Number 7, mild dehydration. It's a quiet mistake, but it changes everything. You skip your morning water. You're not thirsty, you're rushing. You think, I'll drink later. But when you arrive at the lab, your blood is thicker than it should be. That simple act of not hydrating concentrates everything. Bun, creatinine, cardiac enzymes, electrolytes. You might feel a little off, a little tired. But to your doctor, it looks like kidney stress, maybe early-stage heart issues. And from there, the snowball starts. More tests, more worry, more confusion. The fix? Simple. A full glass of plain water, 30 to 45 minutes before your test. No lemon, no sweetener, just clean hydration. That small habit can keep your results accurate and your peace of mind intact. Number 6, coffee, black tea, green tea. No cream, no sugar, just harmless caffeine, right? Not exactly. Even a cup of black coffee or green tea sets off a chemical alarm in your body. Your adrenal glands get the signal, time to work. They pump out adrenaline, cortisol, your body's fight-or-flight hormones. And what follows? Blood sugar rises, heart rate quickens, stress markers light up. You're sitting still, but your blood says you're in motion. To the lab, that looks like inflammation, maybe prediabetes, or even early cardiovascular strain. So what's the better move? Skip it. On test day, no caffeine, no stimulants, no gentle energy, just water, because clarity begins with calm chemistry. Number 5, not reporting recent illness or OTC drugs. Gloria felt fine. No fever, no cough, just a minor cold 3 days earlier. She took Tylenol and cough syrup like anyone would, and got on with life. But when her blood test came back, something didn't look right. Her liver enzymes were high. The doctor paused, ordered more labs, sent her for an ultrasound, scheduled a specialist. Words like hepatitis were mentioned. Gloria panicked. Her daughter started Googling. Weeks of anxiety followed. What really happened? Her body was still resolving the cold. Her immune system was winding down. And acetaminophen, her over-the-counter lifesaver, nudged her liver markers higher. It was all normal. But without context, the lab couldn't tell the difference. One sentence could have changed everything. I had a cold this week. I took Tylenol. That single note would have rewritten the story and spared her all the fallout. So next time you check in for a test, speak up. Mention every cold, every cough drop, every pill. Because your blood has a memory, even when you've already moved on. Number 4, skipping heart or blood pressure meds. Larry wanted the purest results possible. So the morning of his blood test, he skipped his usual beta blocker just this once. When the nurse checked his pressure, 158/92. His doctor didn't blink. He increased the dosage, thinking Larry's condition was deteriorating. But the next day, back on his meds, Larry checked at home. 124/76. Perfect. One skipped pill, one misread lab, one prescription change that shouldn't have happened. The mistake wasn't just skipping the dose. It was forgetting that blood tests should reflect your normal daily state, not an artificial version of yourself. Your doctor needs to see the full picture, with medications included, unless they tell you otherwise. Never adjust your prescriptions on your own, because trying to clean your results can make the whole story look dirtier than it really is. Number 3, testing at the wrong time of day. Your blood test result isn't just about what's in your blood, but when you draw it. At 7 a.m., your cortisol levels naturally peak, preparing your body to wake up and function. By late afternoon, they drop. But if you test at 4 p.m., your doctor might misread that drop as hormone dysfunction. Triglycerides, too, follow a clock. They're often 30 to 40% higher in the afternoon. So if you test after lunch, your numbers could make you look like a cholesterol risk, even if your morning readings would be perfectly fine. Timing matters. The body runs on rhythm, and labs were designed around that rhythm. The gold standard? Test between 7 and 9 a.m. when fasting, rested, and calm. If you can't, make sure your doctor knows what time the test was taken so they're not diagnosing the wrong problem at the wrong hour. Number 2, trusting a single lab result. 2 days, 2 labs, 2 readings, 25 points apart. Same person, same diet, same everything. But when the second test came back with higher cholesterol, the doctor didn't question the method. They prescribed statins immediately. What went wrong? Labs differ. Equipment, techniques, even how long a sample sits before being processed. It all impacts the numbers. More importantly, one test is just that, a snapshot. It doesn't show patterns. It doesn't confirm trends. Basing a major decision, like lifelong medication, on a single result, that's risky medicine. Ask for a second test. Track your numbers over time. Look for consistency, not outliers. Because your health isn't a moment. It's a moving story. And one off page doesn't mean you rewrite the whole book. Number 1, post-meal test using fasting standards. You had breakfast, maybe toast and coffee, maybe oatmeal and fruit. An hour later, you took a blood test. Your glucose? 172. Your doctor saw the number and said the words, "We need to talk about diabetes." But here's what they didn't ask. When did you eat? Because 1 to 2 hours after eating, glucose often ranges between 150 and 180. That's not a problem. That's your body doing exactly what it should. But when your doctor compares that number to a fasting standard, usually under 130, they're not measuring digestion. They're mislabeling it. And once that diabetes label goes into your chart, it's hard to undo. If you've ever tested within 90 minutes of a meal and got a high glucose result, don't panic. Ask for a retest. Early morning. Fasting. Calm. That's the only way to know what's real and what's just breakfast talking. If there's one habit that could transform how you manage your health, it's this. Stop treating your lab results as final judgments. Start reading them like trends. Blood test results are like snapshots. They show what's happening in your body at a single point in time, but not where you've been or where you're headed. That's why keeping a record of past results is essential, especially as we age. Here's how to do it. Create a simple chart with 5 columns: date of test, time of day, fasting or post-meal, any stress, illness, or medication changes, key lab values, glucose, cholesterol, liver enzymes, etc. When you line these up, patterns start to emerge. A glucose level of 140 might look high, but if it only happens after poor sleep or stress, and your other readings are stable, it tells a very different story than if it's rising every month. More importantly, take these 3 questions to your doctor every time. Is this number part of a short-term fluctuation or a long-term trend? Could this result have been affected by food, stress, or my current medication? When should we test again to confirm or rule out a real problem? Because real medicine doesn't just look at the numbers, it looks at the context behind them. And when you track your own data this way, you're not just a patient, you're an informed partner in your care. Coming up next, we'll show you how to spot early warning signs in lab results that doctors often miss. Preparing your body before a blood test is just as important as the test itself. Here's a natural approach to help ensure your results reflect your true health, not temporary distractions. 48 hours before your test, choose whole foods that nourish rather than spike your system. Swap fried or processed meals for leafy greens, colorful vegetables, and lean proteins. These foods stabilize inflammation markers and support liver and vascular health. Stay hydrated. Aim for 6 to 8 glasses of water daily. Consistent hydration keeps blood plasma flowing smoothly and helps deliver accurate readings. Prioritize rest. One night of poor sleep can throw off cortisol and sugar levels. 2 nights of good sleep can make a noticeable difference in stabilizing your numbers. 24 hours before your test, pause caffeine, even from tea. That morning cup may spike your cortisol and skew your labs. Stop all supplements and herbal teas, turmeric, ginseng, garlic, unless your doctor explicitly says otherwise. Reduce stress. Avoid major chores, emotional conversations, or heavy physical exertion. Seniors process cortisol more slowly, and those elevated levels will show up in your blood work. Morning of your test, only drink water, plain water, no lemon, no sweeteners. That glass helps hydrate your plasma and set a calm baseline. Arrive early. Sit quietly. Breathe deeply. Your body is most truthful when it's at rest. Bonus, want this in a handy format? Comment checklist blood below, and we'll send you a 1-page test prep checklist. Simple, printable, and ready to use on test day. Simple mistakes that led to surprising diagnoses. Turmeric and honey each morning. A viewer in Arizona shared how her daily ritual of turmeric steeped in warm milk led to elevated liver enzymes. It didn't signal liver disease, it just reflected her supplement habit. A break from the routine returned her results to normal. Yoga before the lab. Another viewer, a retired teacher, practiced gentle yoga before her blood draw. Her CRP and cardiac enzymes came back high, triggering worry about heart inflammation. As soon as she skipped the morning stretch, the numbers normalized, reminding us that even calming habits can alter labs. Juice and fruit before test. A third viewer tested her glucose after a glass of juice and some fruit. Her result, 176 milligrams per L. The doctor labeled it diabetic. But when repeated fasting, her glucose came down to under 100, normal. It wasn't diabetes. It was digestion. These stories might seem small, but they reveal a bigger truth. Minor habits, unexamined, become major misdiagnoses. Your blood remembers much more than you realize. Have you ever looked at your blood test results and thought, that doesn't match how I feel? Maybe a surprise diagnosis, a prescription you questioned, a test that didn't feel right, but you had nowhere to turn. You're not alone. Share your experience in the comments below. Your story could help another senior avoid confusion, unnecessary meds, or emotional stress. Let's build a community where experience becomes shared wisdom. If this video helped you understand your body differently, consider subscribing. In our next episode, we'll explore 6 normal lab values that might actually be early warnings for stroke or heart failure, especially relevant if you're over 60. Because understanding the numbers and knowing what to ask can protect your health, your memory, and your life. Stay informed. Stay empowered. Your health is worth it.